As Chief of Plastic Surgery at St. Joseph's Hospital, Dr. James Namnoon of Atlanta Plastic Surgery is a renowned leader in both cosmetic and reconstructive surgery. The impact he and his partners have had on plastic surgery is international in scope. Meet Dr. James Namnoon.
Atlanta Plastic Surgery is one of the oldest plastic surgery organizations in the Southeast and certainly one of the largest in the world. This organization is full of a number of plastic surgeons who are amongst the most famous plastic surgeons in the world and have made numerous contributions for the benefit of patients in breast and in pediatric plastic surgery, as well as innovations in cosmetic surgery as well. There are a number of exciting advances on the horizon in plastic surgery. Perhaps the most immediate thought that comes to mind surrounds the advancements in the use of free fat grafting for all sorts of cosmetic and reconstructive problems. For the first time, we've been able to take fat, and it may be that what we're actually doing is taking stem cells and using them to reconstruct, repair, and heal tissues that had previously been unable to treat in any other successful fashion.
In addition to his involvement in plastic surgery research, Dr. Namnoon has wide experience in cosmetic surgery of the face, eyes, abdomen, and extremities. His special expertise is in reconstructive breast surgery and body contouring.
As plastic surgeons, we're all seeing a large number of patients who have had bariatric surgery. These are operations in which various procedures are done to help the patients lose weight. In the process of doing this, however, they lose a lot of volume. It's almost like letting the air out of a balloon, and so they have an excess amount of skin and some excess fat. And so what we do as plastic surgeons is devise procedures that will enable us to take away this tissue and restore their confidence as well as their sense of well-being.
Dr. Namnoon has become internationally known for his work in breast reconstruction.
I have focused a lot of my career on breast reconstruction because it's hard to explain why, but I've always had a great deal of emotion and concern regarding breast cancer patients. I think taking care of these patients is probably the highest calling in our profession, and it's one in which we can combine all the elements of aesthetic surgery with reconstructive surgery and take patients who are really suffering and make them well again.
All of a sudden, I just sort of felt an itch on my chest and just reached up to, and felt this lump. And it was at that point I thought, oh my gosh, I need to, see about this as soon as I get home from the beach.
After we had the diagnosis of cancer, the first thing that pops in your mind is, am I going to survive? And after, we realized that was going to work out okay, you start trying to figure out what your options are going to be. That's where we were at a little bit of a loss. And after the appointment with Dr. Namnoon, and we realized what was available there, it made the decision a lot easier.
But it was at that point that, we were faced with, do we do the bilateral construction or just do the one breast? And we just felt like, well, I didn't want to have a mammogram every 6 months to check to see if the cancer had gone to the other breast, so I just felt like it would be much easier living with having the reconstruction after it was explained to us. And Dr. Namnoon did such a wonderful job with that and put me at ease and explained the procedure, and I just felt like it was something that would work for me. I didn't know at the time, it just seems like you might not get through it, but somehow you do. And I just feel like we just definitely did the right thing for us. And we are just so thankful to Dr. Namnoon.
We have a number of options available for the patients who are presenting to us with new breast cancers. As you know, this is a critical time in the patient's lives. They've just been given a devastating diagnosis, one in which no one can really be prepared. And I see our role here as plastic surgeons, in particular, as helping guide the patient through a terrible process and restoring them to a sense of wholeness at the completion of that process.